Hello everyone, I'm News 2 meteorologist Marcus Bagwell, and it's time for another edition of News 2 Gives Back. It is Wednesday, May the 24th. We are continuing to honor those that helped support the students, the faculty, and the staff at the Covenant School regarding their tragedy that took place back in March. We have visited several sites over the last few weeks, and this is going to continue even as we head into part of June. And today we're stopping at the Mental Health Cooperative here in Nashville, and they do a lot of work. They actually went out on the day of the tragedy to help provide support and counseling to the students, the faculty, and the staff over at the Covenant School. And we want to be able to recognize them for their work, but also hear more about what they do, because they do a lot of things around the Nashville area, which is very important. So I want to first start with Michael Randolph. Michael, great to meet you. Thank you for your time, and we're very excited to honor you and your team. Tell us about what the Mental Health Cooperative is and what you all do.
Yeah, the Mental Health Cooperative is a community mental health agency where we have outpatient services, case management, substance abuse services, med management. We have a pharmacy. We have a lot of different services. We also have our crisis services with our 24-hour walk-in center and our crisis treatment center with grant-based beds where people can come in at any time, 7 days a week if they need help. We have our mobile crisis services, and then I'm program manager in charge of our Partners in Care program and our REACH program. Our Partners in Care program is where we pair master's level clinicians with police officers. The clinicians are embedded on a precinct level. We are in 6 out of the 8 precincts by the end of the year, with citywide next year. All of our clinicians ride with officers that receive a 40-hour crisis CIT training, and we primarily answer mental health calls and then also help officers answer any other calls for service that day. Since the launch of the pilot, we've answered over 3,000 calls that are mental health related, and about 11 to 12,000 other calls as well.
Okay, so you partnership with the Metropolitan Police Department, and y'all are out on the streets each and every day, and the range of mental health things I'm sure is a lot, but what is your ultimate end result with being with a Metro police officer when y'all go out on these particular calls?
Yeah, it's a citywide effort to really have a more robust crisis response in Davidson County. So there's 3 main goals of the program, and that is to divert people from the criminal justice system into the healthcare system, the safety for the person in crisis, safety for the officers, safety for the families, and safety for the counselors. And our third goal is to streamline care. So if somebody is in crisis and they call 911 for help, or their family calls, that clinician who arrives on scene can walk them through that crisis to the point where they can get care, and we hand that off to other people who can help them. That person doesn't have to tell their story over and over again. They have someone that they can ask questions to, and we keep people de-escalated and kind of walk through them from the beginning of the crisis until they get the help they need.
Okay, and the care that they receive, is that through here in this facility, or do you all send them to other places?
Yeah,
how does that work?
About 50 to 60% of our incidents can be resolved on scene. About half the people we see are actively suicidal, are experiencing psychosis to the point where we're afraid it might be putting themselves at danger or others at danger. So a lot of the times we can do a safety plan at home, work with families, their outpatient providers, for them to remain at the home and follow up with them. Sometimes we can bring people to our crisis treatment center to get help immediately, and then sometimes as a last resort they might have to go to a psychiatric hospital.
All right, sounds good. Well, I want to talk with a couple of your other folks here. So we have Miss V and Miss Amy. Miss V, tell us about what you do on the streets day in and day out.
Well, pretty much we primarily answer crisis calls through the dispatch units at Metro. My unit is a bit different than other people. We don't go on all of the calls that the rest of the officers and counselors go on, but we are a part of what we call the Quality of Life team. The Quality of Life team assists the homeless community within the Central Precinct unit, which is where I'm assigned. So a lot of the people that I come in contact with are unhoused and, of course, experiencing some level of mental illness. So we do an overall wraparound service for them. We handle the mental health portion, but we also assist with branching out with different resources and providing the homeless with what they need to have a overall productive life.
Okay, so does this also mean, talking about the homeless and those that don't have a permanent shelter, does this mean like getting them to other agencies here inside of Metro as well? Is that some of the help that you provide them with, along with their mental health as well?
Yes, we partner really well with other agencies, but the biggest, greatest agency that we partner with is the Salvation Army, and then have a really good connection with the Room in the Inn. So we work well with those agencies to get them additional services. And as I try to tell the consumers, if you get your name on any and every list, the greater chance that will be that you'll be able to be assisted.
Great. Ms. V, thank you very much. Great to meet you. Thank you for your
Nice
service.
meeting you.
Ms. Amy, tell us a little bit more as well about what you do.
Sure. So I, like Michael covered it, we go out with Metro and we go primarily to mental health calls, active suicidal or consumers in psychosis. I see a little less of the homeless population as V does, but we try to connect them to resources, try to make them as safe as possible. Going on either non-mental health calls, just kind of being there for some of the people who may be in some sort of distress at that time of a police call, trying to divert criminal justice system, and trying to just see what's best for them, try to help them out.
Sure. And what would you say is important for people to know? Mental health is so important. It's been that way, I think, ever since the pandemic. Like, the mental health has really been a big emphasis, and it's rightfully very, very important. What should people know if they are really struggling with mental health and they don't have people to turn to? What would you recommend for them to do?
So I think it's important that we have, 24-hour crisis counselors available. We have hotlines, mental health co-op. We have the mobile crisis team 24 hours. As long as someone's willing to ask for help, I think we always have those resources available for them.
All right, great. Thank you, Amy. Appreciate it. It's so great to be able to recognize this group. As I mentioned earlier, they were part of the first responders that went out and helped the staff and the students who were going through a very traumatic, very difficult time, something that no one wants to experience. They were right there to be able to help, and even probably to this day still helping some of these people out. And then here in Metro, they're helping out with a lot of things. So there's great information about this with the Mental Health Cooperative here in Nashville. I was reading up more about it, and they service not just the Nashville area, but also some of the surrounding locations too. We're so excited to provide them lunch for today, and it's such a great opportunity to do that and to thank them for their service in the Covenant tragedy that took place back in late March. All of this is brought to you by the Nashville Subaru in partnership with the Nashville Predators, and we're excited to be able to serve them and provide them lunch for today. I'm News 2 meteorologist Marcus Bagwell. We hope you have a good rest of your day.